My name is David Haustine, and I serve as the Associate Dean for the University of Missouri School of Medicine Springfield Clinical Campus. The University of Missouri School of Medicine can take in 128 students per year. Seeing that there was such great clinical volume in Springfield between Cox and Mercy, that was a logical place to place third and fourth year medical students. So about 4 years ago, the campus opened down here in Springfield with just 9 students initially, but we've gradually grown to now having 49 students in place that are training at Cox and Mercy predominantly.
My name is Allison Hall. I'm a fourth year medical student at the University of Missouri School of Medicine. I was born in South Dakota and finished high school in a small town in Missouri near Rolla. I knew I wanted to pursue healthcare in some aspect. Ultimately I decided I wanted more of a provider role. I was working as a scribe, and seeing that firsthand in the emergency department made me really want to pursue medicine.
During your third year of medical school, you get trained in a variety of disciplines. Here in Springfield, during their third year, they rotate in child health, obstetrics, gynecology, family medicine, internal medicine, surgery, psychiatry, and neurology. And so they go through these experiences spending about 8 weeks learning each of those disciplines. And so the quality of their education is extremely important. Usually in healthcare, when a person is trained, they look to their mentor and trainer for so much guidance there that whatever that trainer is doing, that's frequently what mirrored in the student's practice. And so it's extremely important for that training to be of the highest quality. Right now, they're predicting that in the next 10 years that there will be a physician shortage between 50 and 140,000 physicians. And so MU has known that training up physicians is going to be a priority. Springfield is a really special community, so the healthcare volume that Springfield experiences is pretty astounding. Between the two health systems, there's almost 2 million outpatient visits per year. There's over 6,000 deliveries, I think over 76,000 surgeries. So the clinical volume that's happening here in Springfield is pretty remarkable.
I did my undergraduate degree here. I was familiar with Springfield, and I knew that it would be a good place to train. It's a level 1 trauma center. We have a great patient base. There's a component of underserved communities here. Not having residents here is such a unique experience for medical students because we get to work one-on-one with the attending physicians. We get to learn from them directly. We also get a lot of hands-on experience in caring for patients and having a lot more responsibility than we might have ordinarily as a medical student. Here, without the residents, you are doing more of the procedures, you're talking to patients more, you're presenting your assessment and plan directly to the attending physician, and so you're more responsible for the patient's care and plan in a community setting, whereas in a university setting, you might be having a lot more discussions and team meetings and kind of learning in that environment. The big reason that I really wanted to come here was that I wanted to kind of have that one-on-one experience where I needed to know exactly what I was doing. And then also just the community in Springfield is such an interesting population of people who really need healthcare. We have such a large rural area where people are traveling for hours to get here to get basic health care, as well as the experience at Jordan Valley Clinic. We've had such a wide variety of experiences. I had the opportunity to rotate at the Federal Medical Center for U.S. prisoners for my psychiatry rotation, and really just a robust and unique experience compared to the typical third and fourth year rotations. We all learned how to be very flexible and adapt quickly to the changing kind of educational environment in the healthcare setting. We did a lot of telemedicine rotations initially in March and April, as well as I think into May before we were able to get back into the clinical environment.
With the pandemic, it's been really interesting. Our students had to pivot from a lot of in-person experiences to some Zoom and virtual experiences to interview patients and learn their skills. The student experience is largely unchanged. If anything, they actually seem to have more experiences and more tools in their toolbox because they are so adept at telehealth now and experiences seeing patients virtually. So the students have really been resilient and continued on with their education just pretty much as normal. In America, there is a need for primary care physicians and subspecialists as well. So I feel like the projections of what we will need in like 2033 is a variety of disciplines within medicine. We're thankful that at the Springfield Clinical Campus we have had 100% match rate for our students here. They get incredible training through Cox and Mercy, also our other places in town, Jordan Valley, FedMed, and Burrell. Once they have done their residency training of 3 to 7 years, we hope that they'll return to this area and be a part of the quality medical community that exists. We started this campus in 2016, and initially we just had 9 students, and then 10 and 11. Well, our 4th year medical student class here in Springfield has 28. So while we have graduated about 30 students before now, as of May of this year, that number will double from 30 to 58. Medical school residency training is 3 to 7 years, and so our very first class that graduated from here in Springfield will actually be finishing residency, if not this year, then in the following years. So we're really expecting to gain some traction for physicians to start coming back to this area. We have had, in our very first class, we had a student who's from this area, and he decided to go train at Mayo Clinic in dermatology, a very respected program, and he has committed to coming back here to Springfield and signed on with a local hospital to come back. And so he's one of our first success stories of people, of someone who's going to come back to this area. But we have several other students that have already graduated and that are in our classes right now that say, I want to come back home. So we're excited to have those stories to share in a few years.
I would absolutely consider coming back to practice in Springfield. Having lived here and worked here, I think the patient population is amazing. I think this is such a unique healthcare community in terms of having 2 different hospitals that both have incredible opportunities in terms of providers, and the ability to establish a practice here would be a great opportunity for me.
Our current M3 class is the most diverse class we've had here in Springfield. We have about 17% underrepresented minorities on the Columbia campus, but that's never been quite mirrored here in Springfield until this year. And talking to our students that come from a diverse background, they say they're having an incredible experience, and they may have had some hesitation about signing up to come to Springfield, but the reality that's playing out is they are having an incredible time. We have over 350 physicians who are faculty for University of Missouri here in town between Cox and Mercy. A lot of them are at the assistant professor level, but they're volunteering their time to spend with our students. And physicians are very giving people, and a lot of them are natural teachers. And so to hear their stories about how taking on a young student has reinvigorated their career and been able to feel like they're giving back to the next generation, that's really encouraging. Not only are our students incredible, but our faculty are incredible as well, raising up this next generation.